number 4 on the way to 11.
I'm Rosie Stovitz from Mount Penn, and I just wanted to, I know I let you know already that I'm a proponent of single-payer health care, and I understand that that's off the table in Washington, but that's okay, because we're going to do it in Pennsylvania and show you how. During the campaign, President Obama had promised to take away the subsidies of the Medicare Advantage plans, and I think that would go a long way in helping to achieve health care fairness. Because private insurance companies, I don't know how many of you know this, private insurance companies that sell Medicare plans do so because we subsidize them, and that costs us money. If they can't do it competitively on their own, they have no business being in the market. So I'm just wondering how you feel about that particular aspect of healthcare, the subsidies for the Advantage plan.
Well, Medicare Advantage, as the lady points out, they do get a bonus, and it's on the table. We're looking hard to find ways to pay for the healthcare program, and it's under consideration. Absolutely. Well, we got a big table. If you read the newspapers, which I know you do, because I know how much interest there is in this room on health care, you see there are a lot of things we're considering. A lot of matters. Number 5 on the way to 11. Yes, sir.
Randy Kozlowski, Martinsville, PA. Earlier you talked about your health problems, and as a member of the Senate, you were able to receive treatment. You then talked about U.S. government invests in research. I worry about once science comes, it's becoming privatized by various doctors, hospitals, and insurance companies, okay? But yet it's funded by the government. And we have millions who do not have health care. And I wonder, why can't we have single-payer universal health care? Since no one owns the medical science that has improved over generations of time, it's becoming put in the hands of various people. And one second little question. I've learned to admire the Jewish people for their intelligence, their artists, and their scientists. When they say never again as they vigilance in the Holocaust, they just mean for themselves or for all of humankind. Because sometimes my support of Israel gets a little tainted by their actions in the Middle East, where they need to be the guardian of Holocaust, not create a possibility where they can be used for people like that.
On your key points, number 1, the single payer. Listen, as far as I'm concerned, the table is big enough to consider everything.
I get to the table, and I know you're not responsible.
Well, there has been an aversion to it because of the bureaucracy. That has been the point. Well, listen, it's debatable, but you ask me what's happened. That's what's happened. You talk about the Holocaust, absolutely. Never again, and humanitarian principles apply to all people. The situation in Israel is very, very problemsome on all sides. It's problemsome because in Gaza, Hamas is in control, and Hamas has a charter for the destruction of Israel. And they send shells from Gaza into Israel. And from the north, you have Hezbollah and a destabilized Lebanon. And you have Iran threatening to wipe Israel off the face of the earth. So that when you have a tiny country, a few million people, surrounded by 100 million who are still at war, you have a lot of difficulties. And I think that President Obama and George Mitchell, who's the special envoy, with the two-state solution, improving the economy, and strengthening the Palestinian Authority, can stabilize the situation and lead us to an answer. But on never again and humanitarian principles, that's not just for Jews, for everyone.
Palestinians.
Palestinians and